In this video, we're going to go over how to fix a back hump for good using no equipment. Stay tuned. Hey everyone, Dr. Rowe coming to you from SpineCare in St. Joseph, Michigan. In this video, we're going to go over some great stretching exercises that are geared towards getting rid of a kyphosis in the upper back. That's also known as a back hump or a hunchback. I'm going to show these exercises in a very easy to follow three-part guide. We're going to focus on mobilization, stretching, and strengthening of the upper back, which will hopefully lessen that kyphotic curve, improve our posture, and prevent it in the future. If you're looking to get the best results, go through all three parts. As a bonus, all of these exercises can be done at home, do not require any equipment. So let's get started and fix that back hump right now. In this part, we're going to focus on a self-release or self-mobilization of the upper back to tackle joint stiffness and muscle tightness. I really like this method because gravity is going to do all of the hard work, and we can really put the back into extension. That is a backwards movement like this that will really help flatten that kyphosis or back curve over time. I'm going to start at the edge of a bed. Let's bend the knees like this, keep our feet flat. We want the rest of the body to relax. That way we can really focus on that back hump. I'm going to position my back to the point where the bottom of the curve, the bottom of the hump, is going to be right at the edge of a bed. You might want to roll up a towel or use a small pillow underneath your back too for extra support. My hands go right at the back of my head just like this. I'm going to start off by winging my elbows down towards the floor. You should feel an initial stretch into the chest, and also it should feel like the shoulder blades in the back are starting to pinch. Once we feel that, I'm then going to lower my head, just let gravity take everything, and just let my upper body go all the way down towards the floor. From there, I can also press my head backwards like a retraction to intensify the stretch, but only to your comfort level. The spot at the edge of the bed, your back, it might end up having a sudden pop, crack, or self-release. That is quite normal because this puts a lot of pinpoint mobility into that segment, but don't try to force it. Just go for a deep, comfortable stretch. You want to hold this one for at least 30 seconds, but if it feels good, hold it for longer. You can hold it for a minute. But after 30 seconds, what I'm going to do is take a breather, relax, and then scoot down just a little bit, maybe just an inch, and go to the segment above. And then I'm going to repeat this process pretty much from the bottom of the curve all the way to the top. So pretty much the middle back all the way to the upper back. When I do this too, I'm going to notice that one certain spot, maybe it is the pinpoint top of that back hump or curve that just feels the most locked up and tight. I want to stop over that spot and really focus on trying to throw more repetitions in there. With each repetition, I'm always challenging those muscles by stretching more into it. That is bringing the elbows down more and lowering the head down as much as I can. But just do this pretty much from the bottom of the curve all the way to the top. Focus on the spots that need it the most. And over time, hopefully this extension right here will lead to a less noticeable back hump in the future. So here's an upper back exercise you can pretty much do anywhere. It's going to focus on a big issue, which is bad forward leaning posture. So if you're a desk worker student, I would definitely give this one a try. We're going to focus on big instigators of that kyphosis in the back, which are tight chest muscles and shoulder muscles, which draw us forward, and just a tight upper back. It's a combination exercise, very easy to do. What I'm going to do, start seated with very good upright posture. Let's do a slight chin tuck also to put that in better position. The first part is known as a sprinkler. I'm going to straighten my arms at the elbow like this to the point where my hands are going to be able to clap. From there, I'm going to keep my arms straight, and then I'm going to just take my arms off to the side to the point where the back side of the hands are going to go behind me, almost like towards the wall behind me right here. The more that you go back, the more that you're going to feel it stretch into the chest, and also the shoulder blades in the back are going to start to pinch together. Challenge yourself to stretch that out as much as you can. Once we hit that point, let's hold this for a couple seconds, and then I'm going to bend my elbows at 90 degrees like this to create like a field goal position. Let's wing the elbows back just a little bit more, and then from there, I'm going to go into a wall angel. I'm just going to lift my arms up like this, and then go up until my arms and my hands are going to be able to clap or overlap just like this. Hold it for a couple seconds. We're going to come back slowly and then just straighten out and go back into that original position. You want to do this one nice and slowly. It should take you upwards to 10 seconds to do a complete repetition. But with each repetition, you want to challenge yourself to really stretch into it just a little bit more and try to do this for about 10 complete repetitions. So here is another great exercise that you can pretty much do anywhere. I call this the standing back opener. It's really going to focus also on straightening that back curve. What we need to do is go next to a wall or a door. I'm going to put my feet pretty much about 2 feet away from the door. My feet go hip width apart, and then I'm going to put my arms up like this, straight at the elbow, shoulder width apart. Let's grip right into the door too. We don't want this sliding down. From there, I'm going to tuck my chin towards my chest, and then I'm going to just lower my body weight until I feel a very deep stretch. So what I'm doing is kind of like a squat position, bending my knees, lowering my butt down towards the floor. The more that we do this, the more that you're going to feel a good stretch happen into the upper back. Once we feel that, what we're going to do is then allow our chest right here to go right towards the door. So just let it sag forward. And this right here will really open up the back. And you should really feel it starting to straighten the upper back also. You want to hold this position right here for roughly 30 seconds, but if it feels good, hold it for longer. The longer that you hold this, the more it's just going to open up the back and hopefully start to stretch everything out. Try to do nice, slow, controlled breathing also. Let the tension out. The more you relax, the better this exercise will work. When you need a breather, just come back up. On the next repetition, challenge yourself. So what I'm going to do is just try to stretch more into it. Squat down a little bit more and then lean forward into it to really hit and focus over that spot of that back hump. You want to do this for 3 to 5 complete repetitions. How you can take this one to the next level is instead of going straight out with it, go a little bit off to the side and then repeat that same exercise. You'll notice that it hits the back just a little bit differently. So experiment with going all the way towards the left. Experiment with going all the way towards the right. If you feel that one certain spot, one certain motion hits that spot just a little bit more, focus on that and then just throw more repetitions in. So without a doubt, if we want to get rid of a kyphotic curve in the upper back, we have to focus on strengthening everything in the upper back and neck and also focus on improving our posture. Here is a very easy exercise that I would recommend doing first thing in the morning and before you go to bed. You can do this one right in bed. I'm going to start off on my stomach and slide forward to the point where my shoulders, my head are going to be off the edge of that bed. I'm going to go over 4 different movements that are going to put a lot of motion into the upper back and focus on engaging a lot of muscles in a short amount of time. I'm going to hold all of these positions for 3 to 5 seconds and do this for about 10 to 15 repetitions. With the repetitions, on each repetition, try to build more into it, engage those muscles, and focus over the area of that kyphotic curve in the upper back. Challenge yourself with each repetition. So what I'm going to do is start off by focusing a little bit more into my neck. Let's take 2 fingers, put them on the chin, and do a slight chin tuck. From there, I'm going to raise my head up towards the ceiling. So I'm really driving the head up towards the ceiling to put it into a retracted stance. You should feel a lot of muscles into the neck start to engage. During this exercise, we want to hold this neck retracted stance so we can really focus on improving that forward head leaning posture. So with the first movement, I'm going to straighten my elbows like this, make fists, put my arms off to my side. I'm going to, again, lift the head up, and then I'm going to lift my arms up towards the ceiling as much as I can. You'll feel a lot fire in the upper back, between the shoulder blades, in the shoulders themselves, and also the neck. Again, 3 to 5 second holds. From there, we're just going to relax and then repeat this one 10 to 15 times. The second movement, we're going to take our arms out like this and then just repeat. When you do this, you're going to notice that it hits the muscles just a little bit differently. So go through that motion. And then I'm going to go into the third one with a hitchhiker sign with my thumbs up towards the ceiling, and then I repeat. I really like this one because it really fires into the upper back. The last movement, what we're going to do, is known as a floor angel. So I'm just going to slide forward just a little bit more, drape the arms off like this. I'm going to bend my elbows roughly at 90 degrees. Let's wing the elbows up as much as we can towards the ceiling till we feel the muscles in the upper back engage. From there, I'm going to lift my arms up like this. From there, I'm going to lift those elbows up as much as we can. Really focus on trying to open up the chest and pinch those shoulder blades together. From there, I'm going to just put my arms out in front of me just like this to the point where they're going to be able to clap. And then I slowly come back down just like this. And then just repeat that one again for about 10 to 15 repetitions. But all of those movements together really fire a lot of muscles that will help improve posture and hopefully lessen that back hump. So here is a great upper back strengthening exercise that you can do at home or at work. It's known as a shoulder blade lift off, and we just need a door or a wall. To start off with, what I'm going to do is just lean up against a door or a wall. So my lower back to my upper back is flush against it. My feet are going to go together and just put them slightly in front of you so your body is tilted or leaning into this door. From there, I'm going to take 2 fingers, put them on my chin, and do a chin tuck. Bring the chin down towards the chest as much as you can. I'm going to bend my elbows roughly at 90 degrees and then place them off to my side. The movement is very easy. What I'm doing is pressing into the door with my elbows, which will cause my whole body to lift forward. So what I'm focusing on doing is lifting my whole body forward as much as I can. What you'll notice is the muscles in the chest get activated in between the shoulder blades and upper back. Really focus on feeling that. You want to hold this one comfortably for 5 seconds. From there, you're just going to relax and take a breather. How we're going to take this one to the next level is we're going to scoot our feet just a little bit more forward. The more tilt that we have going, the more challenging this exercise will become. So let's repeat this. It just feels a little bit harder to do now with this extra tilt. So I keep repeating that process, holding for about 5 seconds and then going forward just a little bit more with my feet. You're going to notice that you hit a point where it becomes extremely challenging, and that's where we're going to stop. And at that point, we want to throw in about 10 repetitions of 5-second holds. With this exercise, keep progressing as much as you can. Over the course of days, you'll find that it becomes a lot easier, but just challenge yourself by increasing that lean and focusing on really trying to activate those muscles, which will hopefully lead to less kyphosis or that back curve in the upper back in the future. If the exercise has helped, please support the channel by giving this video a like and maybe subscribing too. If you have any comments or questions, please leave them below. I'll get back to you as soon as I can. Thanks for watching.